I'd like to talk about issues that I find with traditional therapy. I think the reality, having been in this field virtually my whole life, is watching what's happening and being disappointed with the incredible, I believe, slow growth in terms of development of new techniques and methodologies and approaches. Is based on some really important factors, and I think the whole therapeutic community and the community involved in special needs kids needs to look at it very closely and reevaluate it. Some of the innate problems are represented by the perception of how services should be provided. Uh, I was lecturing 40 years ago to groups of therapists about the delivery system and essentially saying, the neurodevelopmental foundation of what you're doing, the neuroscience of what you're doing, is such that you cannot have impact by only seeing a client once or twice a week. Typically for a half hour, pushing it maybe an hour once or twice a week. That just does not fit the neurodevelopmental model of how we change the brain and how we change the function. But that model, if you will, is not based on what is needed. It is based on what has historically happened, how it has historically been done. And in reality, it's based on economics. If you have someone who is being funded by insurance, insurance dictates how much they're going to pay for how much work. If you're working for a school system, the school system is going to dictate how much is done, how much they're willing to pay to address these issues. So with the delivery system, if you will, being rather broken, it creates other problems. One of the things we've done at NACD from the get-go is develop what we are doing, what we do based on an understanding of how things work and understanding what does work. And the realities of that are that if you want to really produce change, you've got to, number one, determine what specific input is correct. And you need to supply that input with sufficient frequency, intensity, and duration. That doesn't mean you do it once or twice a week for a half hour. All right? It generally means you're doing it once or twice or 3 or 4 times a day, preferably depending on what the specific thing is you're working on. And also, it's a matter of incorporating the people who know the child best. Generally, that person or those people who know the child best are the members of the family. It's amazing the different perception therapists often have of a child's function over their parents. I had an experience back in the early 70s. I was clinical director of the United Cerebral Palsy Organization. And we had a speech therapist who came in on a special grant to work with a specific little girl. And this therapist wanted no input from any of our staff. She spent the entire year working, coming in twice a week to see this girl. The last day of school being open for the year, I was meeting with my staff, concluding the year. And this therapist, who never had 2 words to say to any of us during the course of the year, broke into the meeting, totally out of character. She was all excited because the child had said a word. So she was so happy that after a year's worth of work, she produced results and the child said a word. My entire staff sat there with their jaws dropped, mouths hanging open, looking at this therapist, because everyone in the school knew that this child spoke in full sentences, had been speaking in full sentences all year long, and the therapist never knew it. Right? The therapist never knew it because what the therapist knew was what the therapist saw and was not interested in the input from our staff. And often, the input from the family is not readily available or accepted. The family needs to be seen as an integral part of the system. And preferably, the family is used to help implement the services, the therapeutic techniques, the methodologies, so that the family is a very, very active participant. The therapist's role should be primarily at directing the parents, directing the caregivers, directing the people who are working with the child daily on a one-to-one basis. Additional problem with what's happening with traditional therapy is separated into pieces of the child. All right, so you've got the speech therapist working on the speech. You've got the occupational therapist whose definition of their role has changed in recent years and has gone from doing essentially manual function and self-help kinds of things to now more sensory issues and more global issues, fortunately. And then we have the physical therapists who are working on the gross motor aspects. And then we have the people in education and special education who are perhaps working on the cognitive educational aspects. Well, the reality is the kids don't have pieces that are isolated. You have a child who's having problems, for example, with walking. And the walking doesn't just involve the muscles and the limbs. It involves the vision. Is the child able to converge and see depth? It involves hearing, auditory function, vestibular function. All right, those are part of the balance mechanisms that are going to affect the child's ability to balance and move. We have cognition, which is the child able to take direction, understand what we're saying, and be guided. And then we have the personality of the child. So we have a lot of aspects that affect all aspects of the development. And, to some degree, there's discussion of working as teams. But generally what that reality is, there's a team of people working on the child. They're not really working too much as a team. All right, and then you have them, each of the individual therapists prescribing what they think is appropriate for their piece of the child without looking at the whole situation, the whole day, the whole life of the child. So that's a complication. We then have another issue that virtually all therapists function more or less autonomously. Meaning most therapists are doing pretty much what they were taught when they were in school. They may be taking, some classes or attending some seminars or some trainings and adding some things to their toolbox. But ultimately, the therapists are pretty much doing their own thing with their caseloads. And, that caseload may be, very small, as in like 10 clients, or it could be very large, like maybe 50 clients. Most therapists are not working with caseloads larger than that. And working autonomously, right, they can only take the data they get from their caseload to perceive if what they're doing is right or wrong, helping, not helping. Which again, as mentioned before, is complicated by the factor that if they're only administering those things once or twice a week and not fitting the neurodevelopmental model, even if they were applying good methodology, the right methodology, the delivery system doesn't permit the results to occur as they should. So essentially, that autonomy means that the field has very poor data to to implement new things and apply new things. One of the things I've insisted upon since I started NACD is that all of the individuals who we have conducting evaluations, designing programs, address things the same way. And that's pretty significant. All right, we typically have a caseload of about 1,000 kids. And not only do we have a caseload of 1,000 kids, for the most part, our children are receiving therapy at least 5 days a week. We call it program. And as such, we're getting a lot of input in. And because we have such a large client base and we are approaching things the same way, we can implement something new and very quickly get some feedback and data and see, does this work? Does this not appear to work? Does it work with this segment of the population but not that segment of the population? And very quickly modify and adjust and develop what we're doing. That process permits us to be very specific. And in terms of actually changing a child, the task becomes identifying the specific input that is going to be producing the change, supplying that input with sufficient frequency, intensity, and duration. Okay, that's what produces the change. As of today, we're using over 3,000 different specific methods and techniques so that we can be, in fact, very specific and very eclectic in terms of working with all kinds of techniques and methodologies. We have a orientation 6-hour CD program that families listen to before they start with us. It's 6 hours to educate them about child development. In that 6 hours, there's no discussion of methodology. It's philosophy. It's a neurodevelopmental philosophy. Right? And the reason I did not discuss methodology is we are constantly developing methodology. We are constantly developing techniques which we can do because we, number one, have the perception that we can never do this well enough, that there's always a better way. So we're always looking for a better way. If I were looking at what we were doing and saying we're doing the same thing today we were doing last year, I'd give us a big F. All right? That's failure. If we're not moving, we're not changing, we're not learning, we're not developing, we are not doing the job. And sadly, I think most of the therapists are doing largely the same things because they do not have the delivery system, they do not have the base, the network, to really develop the science of what's happening. And they're working with their piece of the child as opposed to working with the child as a whole. So I think the potential, is great of what we can do. I'm hoping to enlist more and more therapists who have really great training. The basic educational model that therapists receive in terms of their understanding of the pieces is terrific. I think the methodology that they're taught is questionable often and tends to be stagnant. But their basic understanding and their motivation for doing what they're doing is terrific. People don't go into these fields for any reason other than they really want to help kids. So we've got a good basic education. We have people who are generally smart, people who are generally motivated, and what they need is a different delivery system. They need a network, and they need a philosophy that we can produce better change if we understand these issues better and that we can never do it well enough. Thanks.